Many of you know what Benefit Help does. We're a national broker. We can do all the employee benefits, that, including supplementals. Our target market is with those companies with 10 employees or more, helping to communicate all the benefits, which results in the companies realizing improved productivity, reduced turnover, more importantly, improved or lower total benefit cost. Some of our target markets, Philip, pay attention, Gould's, Hollywood Feed, Fred's, AutoZone, and that's what you've heard me say for the last several years, right? But today I'm going to talk about something different, and that's the help card. Many of you ask about it. What is that? It's that card. First of all, a disclaimer. This is not a personal pitch to you. You will not see any handouts. I just choose not to market that way. However, if you see something that you are interested in what I say, write that down where it says myhelpcard.com, www.myhelpcard.com, and we can go into more details, or we'll do a one-on-one. Disclaimer, this is not insurance, okay? It does not comply with the Affordable Care Act mandate. It is a discount program. I can't be any clearer. What's going on? Well, if we look at the healthcare industry today, there's fewer MDs. There's an increased demand on medical services with the aging population. You have rising health insurance costs that's going to be coming on, and deductibles are getting larger. You're going to see a move to an individual going to $5,000, family deductibles $10,000 and more going. What can you do? This discount cards and things like that have been around for years. Benefit Help has, using a company, a national company, have put together 3 different programs, 3 different levels of coverage, and I'm just going to talk about that. One's going to be the Help Access Doc Plus. What that is being able to go, imagine you have a routine cold, instead of going to your primary doctor, emergency room, or one of the doc in the boxes, you can pick up the phone, call them, or use your handy app, Teledoc, and within minutes, talk to a U.S. certified doctor, have them diagnose what's going on. Again, this is for routine things, sinus, allergies, urinary tract infections, etc. And if everything works out, they'll get you a prescription, and you can have your prescription on the way home. Think of the time savings. And also, that includes discounts on drugs. The second card would be the Help Access Doc, but also adding a discounted dental and vision program. And the third one would be the Help Access Max plan, which gives you actual discounts on actual doctor visits, hospital stays, testing, along with all the other things that's in the base plan. That runs about $30, but that covers the whole family. The other one runs around $15, okay? But imagine where that can be used. Like on the dental plan, I have a dental plan. Most plans pay up to a certain amount, or they have limits. Thank you. They have limits. I use that discount plan to help bring my costs down. For example, a crown, about $850. My dental insurance would pay about $350, okay? So I would owe, about $500 on a regular basis. I go to my dentist, who happens to be in the network. He charges me $450. So if you didn't have dental insurance, you just save $400. But with me, I get it down. My insurance pays a $350. I pay $100. So you can use it in conjunction with that. One of the things, you said you have laser on here? See where it says lab discounts on the Help Access? I was looking at it, and you go and do a blood work, Many of you have physicals, right? Or people have physicals, they're going to draw blood. And there's one called the Conventional Wellness Panel. It's about 50 different tests. Normally the hospitals charge $535 for that, which is what you'll pay. Through here, the lab discount is $97. So you can use it in conjunction with people can use it in conjunction with their own health insurance and help get lower cost. Where we're going, target users, it's going to be people in rural areas. Be thinking about that, because with fewer doctors, there's going to be fewer doctors in the rural area. So now they have access through the phone to get for routine kinds of things. Those who are uninsured or uninsurable, because the card covers all pre-existing. By the way, the rates that you saw covers the whole family. And to call a doctor costs you nothing. So it's unlimited, 24/7, 365 access, holidays, weekends, things like that. Those that have high deductibles, instead of you reaching in and paying, instead of people reaching in and paying, 3 minutes, thank you, reaching in and paying for doctor visits and that, $150, $200, and it's a routine cold, sinus, whatever, pick it up and get their medicine. Speaking of medicine, most of the time, there's plans now where your prescription deductible is tied in with your hospital deductible. Does that make sense? Does that make sense? So people who were used to taking a lot of meds got to meet now their hospital deductible before they get that drug card could come in handy. Working mothers, oftentimes they're going to take time off of work to go take Johnny or Susie to the doctor for a sniffle. Now they can do it from the comforts of their desk or from wherever they're working, and without leaving home, without leaving work, thus improving productivity. And for those who are very healthy, they may want to self-insure. All right, I've gone through, I've taken a complicated thing. A couple quick questions. Yes?
I have to take medication on a regular basis, so every month I'm going to the pharmacy. But the drug I have to take is not a generic because I can't take it. Mm-hmm. But anyway, what I'm wondering is, does this card help me paying for that particular every month?
Yeah, you can get savings anywhere from 10 to 85%. It's good at Walgreens, Walmart, CVS, Rite Aid, and 60,000 pharmacies. What we find is oftentimes insurance companies will have formularies that exclude coverage where the card will pick up and really help people. Yes, Pat?
Just an answer to that question. I had this plan through my company.
Right.
And my prescription was $75 for 30 tablets, no generic. Once I got this, it was 40 and change for 90 days.
So think about that. People can use that, and that 40 you paid, and if you have insurance, can go towards your deductible. Yeah.
You was mentioning making appointments and seeing the doctor without leaving home, for mothers.
Right. Very quick.
Point?
And I think we'll wrap up. I see David coming up. How teledoc or how teledoctor works, telehealth, is and it happened to BNI a couple years ago. I called, said, hey, I feel the sinus coming on, sinus infection coming on. Call me in 20 minutes. Got out of the meeting. It happened at Crescent Center. And the doctor called me back, pulled up my medical history, which I already inputted online, takes about 12, 15 minutes to do, and told him my symptoms. He said, okay, sounds like you need this, this, and this, and called in a prescription. So I left BNI, talked to the doctor while I was in the car, drove to Walmart, picked up my pharmacy, and was in bed starting medication within 2 hours of the call. I didn't have to wait and it didn't cost me anything. It's unlimited. It's on a case-by-case basis. It's not going to be if you have ADD or things like that. This is a perfect time to do a one-on-one. Again, I'm not really pushing that on you, but if you have a need or you know people that, any of these folks that I could help, it's tremendous. Thank you. And I appreciate you.
Thank you
Thanks.
very much.